topic is parental routes of administration. Now the topic is parental routes of administration. In this, what are the different routes we can give through the skin? See, this is the skin having epidermis, dermis, adipose tissue and muscle. Next, I need to come from the top layer to the bottom up to the muscle level. So what are the different parental routes we can give means? First one is intradermal. See, this is epidermis. This layer we can call as a dermis. See, dermis layer. So first I need to touch the dermis layer. See, first I need to touch the dermis layer. Then what kind of its root? The root name is intradermal. Intra means inside, dermal means dermis. So what are the at which angle? See, from top to bottom we need to increase the angle. From top to bottom 10, 25, 45, 90. We need to increase the angle. Means the needle is need to go into the skin. Into the muscle. So see, intradermal angle 10 degree. Angle is 10 degree. See, this is the angle. The angle between surface of skin and to the needle. We can call it as an angle 10 degrees. How much volume we need to take means 0.1 to 0.2 ml. 0.1 to 0.2 ml we need to take. So what is the use of this intradermal route means? For diagnostic purpose. For the diagnostic purpose, this is useful, and for giving the vaccination. Next one is it should be isotonic. Why means whatever we are using, see, some sensitivity test like tuberculin test we are doing here. So the solution should be isotonic. Next one is intravenous. See, blood vessels present in the dermis, not in the epidermis. Blood vessels present in the epidermis region. So next, intradermal. First we need to touch the surface of layer. Within that surface, within the intradermal, there is presence of blood vessels. So intravenous. See, intravenous 25. See, 10, 25, 30, 45, 90 degrees. Angle is 25 degrees. How much ml? 100 ml. See, IV bolus or IV infusions. IV infusion we can give it through IV route. Rapid onset of action. This having rapid onset of action. Next, it causes phlebitis. Means inflammation of blood vessel due to the formation of clot. Inflammation of the blood vessel due to the formation of clot. Clot nothing but thrombus. Next, aqueous solution we can give. Aqueous solution we need to give. Solutions 100% bioavailability. So whatever the drug you have injected, all the drugs enter into the blood vessel. Next one is isotonic. Should be isotonic because the solution is directly entering into the blood vessel. So next one is vaccines. Next one is subcutaneous. Subcutaneous nothing but adipose tissue. The injection is injected into the adipose tissue. See, this is the adipose tissue. Angle 45 degrees. 1 ml. How much ml? Quantity means 1 ml. Only small volume parenterals. Try to remember the small volume parenterals can be given through subcutaneous route in the adipose tissue, 45 degree angle. So vaccines we can give. See, vaccines can be given through intradermal or subcutaneous route. Slow onset of action. Then see, first rapid onset of action. Okay. Then intramuscular. This having slow onset of action. Then IV intramuscular and intramuscular. Intravenous and intramuscular. So what are the drugs we can give through this route? Insulin and heparin. Insulin is a protein. It is having 52 amino acids. It is having 51 amino acids. It is having 51 amino acids. Next one is heparin. It is a polysaccharide. polysaccharide. It is a protein. Insulin is a protein. These are not absorbed through gastrointestinal system. Hence, we are giving in the adipose tissue through the subcutaneous route. See, this is about subcutaneous route. Next one is at 90 degrees. See, straight injection. See, small needle is enough to give intradermal route and subcutaneous route, but for intramuscular route, the needle should be more. But for this, or for intradermal, intravenous, for this small needle is enough. For this large needle is needed because it needs to enter into the muscle. So solutions, what are the, see, through the intramuscular, what are the parenteral solutions we can give? Means parenteral dosage form: solutions, suspensions, emulsions. Solution, suspension, emulsions. Next one is local anesthetics. Local anesthetic. See, when you will inject any dosage form into the muscle, what will happen? Into the muscle, then pain, you can feel the pain. So in order to reduce the pain, we can give the intramuscular dosage form with local anesthetic in order to relieve or reduce the pain. Next one is thixotropy. See, whatever the suspension, flagellated suspension given through the intramuscular route, those will exhibit thixotropy. How means? See, thixotropy nothing but conversion of gel. This is gel form. Refer, see, for this thixotropy, refer rheology topic. Gel form. Initially, see, cross links are there. You can call as gel form. When we have injected the dosage form, it once enter into the muscle, then you can rub the muscle. Once you rub the muscle, what will happen? You are applying some stress or shear. You are applying. We are applying shear. See, whenever muscle, when you will put injected the dosage form into the muscle, we are rubbing here. We are rubbing the muscle here. Then what will happen? When you will rub, you are applying the shear. Shear nothing but stress. Some stress we are giving. Then conversion of this gel form into the sol form. Then sol form is easily moved, having less viscosity compared to the gel form. So thixotropy, intramuscular injection having flagellated suspension exhibit thixotropy. See, why the thixotropy exhibiting means flagellating suspension contains suspending agent or structured vehicle. Those are made up of hydrophilic polymers. Okay, next one is thixotropy. Next, what are the drugs we can give through intramuscular? Antibiotics. What are the drugs we can give through this? Means antibiotics we can give through this route. So this is about the different parental routes of administrations. Parental routes of para means apart from, enteral means GIT, means we are giving apart from GIT. Skin is apart from GIT, hence we are giving the parental dosage form in these different routes.